the main problem we had was not with the providers, it was more with the finance and the billing and being able to get information that we needed to present to the federal government. Since we are a federally qualified health center, we were not able to get the information and the documentation regarding quality improvement, things like that. The billing issues were a big problem, and it just reached a point where they were not able to provide the services that we needed. And so we said we realize it's going to cost money to get a new system, but we are pretty confident that the improvement in financial reimbursement would offset the cost we'd have to do to get a new system. That was the thinking. And I think that's probably the main reason why we switched. Not because the providers were complaining that much, but because they had gotten accustomed to using that system. But once our finance people said, listen, we're losing money, we're not getting reimbursed like we should because of the system, and we can't provide the quality improvement initiatives and information that we need to survive, we need to do something. Yeah. With Centricity Practice Solutions, this is our third electronic medical record. It was rough in the beginning. First couple of days were a little rough, but it's just a matter of learning where to click. And I always like to tell the providers it requires hand-eye coordination. And it almost becomes muscle memory where you don't have to think about it, you've done it so often. And right now we have to think about everything we do. Until you actually get into the system, you just don't realize all the little things you didn't get in the training. But I'm confident over the next week or so, we can develop that muscle memory. Now, one thing I do like is that I like the ability to go home, log on at home, and actually practice and do charts and so forth and so on. And then I make a list of all the things, the questions I have when I come back in the next day. Whoever our instructor is at the time, once I grab a hold of that person, I have a list of questions that came up, and they really appreciate that as well because they can specifically look into what you were having trouble with. And I'll be honest with you, 99% of the time, if you have a question and you can explain what the problem is, they can solve it relatively easily. Yeah.